Good afternoon, everyone. Welcome back here in our ECCMID TV studio, live from the Bella Center here in Copenhagen, Denmark. My name is Judith Cohen. I am your ECCMID TV host, and I have yet another wonderful guest here in my studio with me, all the way from Melbourne, Australia. I would love to introduce you to Monica Slavin, who is also one of the keynote lecturers this year's ECCMID. So a warm welcome to you, Monica.
Thank you, Judith.
Thank you for finding the time and making the effort to come here and give our viewers just a little more insight in what your keynote lecture, amongst others, will be about. So I was told that you lead the National Centre of Research Excellence in Infections in Cancer in Melbourne.
Correct, yes.
That's correct. Yes. So the infections in the immunocompromised host,
that's our core business, and I think we've been funded by the Australian government for another 5 years, and we do have a research program that encompasses from basic to translational research. So I talked a little bit about many of those concepts that we're researching in my keynote lecture.
Yeah, because your keynote lecture was yesterday, right?
Yeah, that's right.
Yeah, so no worries for our viewers, because luckily this Congress is hybrid, so everything has been taped and is visible again on demand. So people who really get a teaser from this interview can also always look back at your keynote lecture, which was called Frontiers in Diagnosis and Management of Infections in the Immunocompromised, with particular, in the immunocompromised.
That's right.
Yeah.
So it's a really exciting area because there's a lot of new developments in diagnosis and management. Yeah. And it was very hard to break it down into a 45, 50-minute talk in the keynote lecture. Yeah. So I really had to focus on some topics that I think are going to be emerging and that we're going to see in the next few years coming into clinical practice, but also not cover them in depth, but give an idea about where they're at and what we might be seeing in the next few years in these developments.
Yeah. So did you discuss like all immunocompromised, so not just oncology, but also HIV?
Well, no, I had to really focus it down. So I spoke mainly about the oncology hematology space, but also talked about solid organ transplantation, as they're the two, I guess, big areas. But I think many of the frontier developments will be applied to across the board to immunocompromised patients. Yeah. So I spoke about 6, fitted in 6 topics, but I think they're very key topics for our patients.
So what are currently the largest challenges within diagnosing infections in these in this very vulnerable patient group?
It's very hard because our patients often don't have very specific signs and symptoms. They may just have fever that you can't really find the cause for. And our diagnostic tests that we use at the moment do have their limitations. So they're not able to really precisely diagnose all infections. So we still end up treating empirically, which means, you don't know exactly what you're treating, but you're giving antibiotics. So a focus in my talk also was about how these new developments will help us target our antibiotics more appropriately, because now there's quite a lot of evidence emerging that excessive use of antibiotics is not just bad for antimicrobial resistance, but it's also bad for the individual patient's microbiome. Yeah. We know now so much more about the associations of a disrupted microbiome and bad outcomes, including, infections or failure of the transplant or other complications of chemotherapy. So it's really an important area to make sure that we do our best to use the antibiotics as wisely as possible. And so new diagnostic tests that help us be more precise about the diagnosis of infection. And also going back to some work that's been ongoing for quite a while about limiting, using shorter courses of antibiotics as well.
Yeah. So I'm still a little bit unclear. So why can't you find the infection in because the immunocompromised, they're probably more aware than the general population that they should be on the lookout for fevers or for any signs of infection.
I think we can eventually find the infection generally, but it takes some time. and some sophisticated diagnostic tests. So often our standard approaches of using blood cultures and culturing other areas don't yield the diagnosis. And so we're sort of a bit stumped, and then we might go on to do some imaging and scanning and try and find out, where the localization of this infection is, and then target that area maybe with a biopsy.
Yeah.
But if we had more precise ways of diagnosing, maybe we wouldn't need to do a biopsy. Maybe we could diagnose it on
so you'd like to have increase the sensitivity of your blood culturing test, because
so
that may be one of the easiest.
Yeah, not only blood cultures, but also moving to the future, I think will be more genomic sequencing on blood culture. So instead of waiting for the culture to turn positive, we'll be able to hopefully use these very sophisticated tests when we understand how best to use them, because I think we're still learning about, because they're so sensitive and pick up so many things, what's important and what's not important in them. But, this DNA sequencing is really, I think, the way of the future diagnostics. I also talked about looking at the host's immune response as well, and there's a lot of work trying to use the host's immune response as a way of diagnosing the infection, because each infection elicits a slightly different immune response, and also using the host's immune response to predict who's at risk for infection, and maybe intervening then to try and modify the host's immune response. So there's a lot of work in that area of immune profiling as well, which I covered.
Yeah. So you're also a member of the Comprised Host Infection Study Group, ESCMID Study Group. So I think you're meeting sometime this ECCMID also. What are your hopes or your expectations from that meeting? Which future directions should we be going in?
It's a fantastic group from colleagues globally, and in terms of some of the initiatives that have been coming out of the group, certainly studies in COVID, of course, and how they affect the immunocompromised host. Also looking at viral and bacterial infections, because again, in the immunocompromised host, you're more likely to see more resistant infections. So there's a couple of studies ongoing about that type of defining who's at risk and trying to predict and trying to act early to avoid resistance in viruses and bacteria. And there's also some initiatives to try and standardise the definitions of how we define infection. Because interestingly, in the immunocompromised host, you will find different publications describing infections very differently. And, in a lot of new literature about oncology and hematology and new drugs coming out, infections aren't always described the same way. So we have a new drug coming out that our patients are exposed to, and we don't really understand what the infection complications are going to be in those patients. So trying to have a more standardised approach is something we're working on as well.
Will that be the outcome of this coming meeting, or more for the... really?
This will come out of the meeting, because there's already been the work done and it's already been circulated and commented on. So this will be one thing that comes out from this meeting. But the other studies will be ongoing with the group.
So in your own research centre, what will your main focus be for the upcoming years?
So I think it's trying to improve surveillance. Another thing I talked about was how it's very hard to capture infection rates in various immune-compromised patient groups, because generally infection surveillance just looks at everyone and doesn't sort of tease out the immunocompromised. So trying to use data science and big data sets to explore how we might more easily get surveillance information is another area that we're working on. So I think surveillance and just working away at improving the way we use antibiotics, seeing if we can use these more sophisticated tests to get a diagnosis earlier and limit our antibiotic use. And also the immune profiling as well, to try and again, assist our recognition of patient risk.
Yeah. So would you say that the challenges in managing these infections in the immunocompromised are actually forthcoming from the challenges that lie within the diagnostic
I think so.
limitations?
Yeah, I think that's a really good point, because the longer it takes us to diagnose and appropriately
Yeah,
treat, that's
exactly.
lost time that
Yeah.
we could be using to better treat the patient, get them out of hospital earlier, get them back
Yeah.
to their more normal life. So it's a really important challenge, I think.
Yeah, and a very interesting field
Yes.
with a lot to achieve.
Extremely
Yeah.
exciting,
Yeah.
because there's a lot of new developments.
Yeah. Well, thank you so much for
That's
taking
okay.
the time and effort to come in here and give us a little bit more explanation. And I think it will serve as a little teaser for people to look up your keynote lecture if they didn't attend
Thank you.
already. So thank you,
Thanks a
Monica.
lot.
Thank you all for watching. We will be back here at 3 o'clock, and we will be back with, let me just check, so I'm not telling you the wrong information. We will be back here at 3 o'clock with the Young Investigator awardees. So we already met 2 of them yesterday here in the ECCMID TV studio, and now we're meeting the other 2. So I will hope to be welcoming you all back as our viewers at 3 o'clock. See you then.